HAS has been working on an innovative community health approach since 1956, practically from the beginning. And this model of community-based health services, where we collaborate with the community to improve their health and prevent illness, has really become a model for other developing countries around the world. I learned about it in public health school, and I've seen that model put in action in Africa and in South Asia. HAS's model for how to deliver community health through collaboration with the community is really one of the gifts that HAS has given to the rest of the world.
We believe that everyone should have access to healthcare in Haiti. This is difficult in Haiti because the lack of hospitals, dispensaries, but everyone should have access to healthcare.
We believe that it's time to put an end to preventable maternal and newborn mortality in Haiti. And every day we're working to do our part to achieve that goal and set an example for the rest of the country. So we try to ensure that every pregnant woman in our service area receives high quality, respectful maternity services, and that the rest of her family also receives high quality, preventable and primary care so that everyone can thrive.
At HAS, we are doing a lot of things to help the people to have health care. In the children, for example, they can't go to school because we try to prevent malnutrition. We go to the community to do some education, to show to the family how to cook, to do sanitation. We do a lot of activities like that. So finally, they will have good health care, they will be healthy enough to go to school.
The people are so resilient, and I think that if we could give them public health, if we can get the health part of it working, we will really be making such an enormous amount of difference. I think one day, and I hope, Haiti will be self-sufficient, but we can't wait until that happens. We want to be there and be part of helping the people be healthy, particularly the women and the children.
Maternal and infant mortality in Haiti is actually worse than many sub-Saharan African countries, and it's certainly the highest in the Western Hemisphere. Meanwhile, Haiti is practically within eyeshot of southern Florida. It's right in our backyard. So we believe that these rates of maternal and infant mortality are just simply unacceptable. In the US, we almost take it for granted that childbirth is a magical time for the mother and for the rest of her family. And we also assume that she's always going to get high quality delivery services so that both she and her newborn survive. But in Haiti, the day of birth is actually the most dangerous day of a child's life, and it's also extremely dangerous for the mother.
To give birth at home, anything can happen. It will be difficult now when something happens, the time to come here at the hospital. So our goal is to tell them, to encourage them to come at the hospital to give birth.
I'm from Haiti, and Haiti has always been home for me. I was born and raised here, and I've been working here for the last 10 years. Well, I'm very hopeful for Haiti's future. I think that we're at a real interesting point in our history. We've been through some very difficult times, and Haiti is not a very easy place to operate a business. But I do think that now very positive things are ahead, and that we will develop economically, and that the future is very bright. I do think that having proper health care and access to health care is very important for a country and a society to develop.
HAS is able to give these patients top-of-the-line cardiac medicines. All these patients can afford their meds because of what HAS does, and that's really impressive because some of them are very expensive meds, and it makes a huge difference in their quality of life. They're still able to care for their children, work, do all the things that you would want to do in a life. I've been really favorably impressed with Dr. Sano's leadership, his vision for the future and his plans to get to that vision.
Now we have 59 years, and my goal, my dream, and the goal of all people who lives in this area is to see HAS for other 60 years.
When people give to HAS, they're not only giving a temporary solution or a Band-Aid solution, they're giving a long-term solution, and a solution that provides a great impact directly and indirectly to the entire community.
Well, there are lots of charities we could give to, and I know many of us give to quite a few. But this one particularly I like because I know what every dollar is going for.
If we don't have donors, we don't have the hospital.
What really makes a difference are the people who donate, because that goes so much further than my days here at HAS. I'm interchangeable. The funds are critical.
We know what to do, we know how to do it, and together we can make a difference.